Morning everyone, and thank you for having me today. So I'm Lucy Chatwin and I work at Newson Health, and we've kind of got a number of sister companies that I just kind of wanted to explain the layout. So I'm the director of Newson Health Menopause Society, which is a not-for-profit that's been established to help improve the education and research around the perimenopause and menopause for healthcare professionals. So working in that space, looking at how we can catalyse new research, because you'd be surprised to know that there hasn't been much research on the menopause and hormones. You know, we're only 51% of the population, but hey. And working alongside that is Newson Health Menopause and Wellbeing Centre, which is in Stratford-upon-Avon with Dr. Louise Newson, which when I joined only 14 months ago, there were 26 clinicians, and we now have over 70 clinicians working there and see more than 4,000 women a month. So I think that just shows the scale of the challenge that we face with the perimenopause and the menopause, and really how underserved it's been for such a long time. And Dr. Louise Newson set up the clinic really to help support her friends. She thought, well, I'll just do it a day a week, you know, because she struggled to get a job within the NHS because they didn't feel as if there was a huge demand for menopause services. And here we are about 4 years later. And as you can see, the scale is just, and the demand has just grown. But what she's truly recognised is that she can't deliver this on her own. The scale is just too huge. And so she decided to set up the Balance app, which is really what I'm here to talk to you about, which is how can we scale and support women with, evidence-based information, a bit like what you were saying, Karen. There's so much misinformation out there. How do we ensure that women have the right information? So what I'd like to talk about is just really sort of setting the scene of Balance, but also to give you a bit of an introduction about the pre-menopause, the perimenopause, because I am one of those people who, up until I entered the world of menopause, I hadn't even heard of the word perimenopause. So I'd worked in the NHS for 14 years and never heard of it. So you got to go, well, how's that happened? How can we have not talked about a major stage in a woman's life? So it kind of bemused me and made me realise that I'm a feminist at heart, because it was just like, how have we not discussed this for so long? So the pre-menopause is obviously when our periods start and leading up to the normal time of life, or whatever normal is, where we're just experiencing our regular cycles. And the perimenopause can happen between 7 and 10 years before our menopause, which is when we haven't had a period for 12 months. So it's very difficult to diagnose, because obviously that time is different for every individual woman, but equally, all of the symptoms that are sort of surrounding the perimenopause, there's about 32 that we're aware of, but as I've said, that it's still trying to sort of unpick what the different symptoms are. So the average age is 51, but none of us have average. So obviously we know that 1 in 100 under the age of 40 will experience an early menopause, and 1 in 1,000 women will experience that under the age of 30. So again, that 7 to 10 years can start from any age really, and that's talking about medically induced. We have medically induced or surgically induced menopauses as well. So where people have had treatment for cancer or other illnesses that need to switch off their hormones, then obviously that tips them into an early menopause. So it's how they get support as well. So what we're trying to do is rebrand the menopause as a hormone deficiency that has long-term health risks, because we know that without our hormones, we are at greater risk of cardiovascular disease, osteoporosis, diabetes, dementia. And so it's about understanding how do we make sure that where women can have their own hormones back, that is recognised and treatment is provided, because NICE guidance, so the UK guidance, states that there is a hormone treatment called hormone replacement therapy that means that you're able to access that through the NHS. So there isn't or shouldn't be any need for you to need to go to a private clinic in order to access care or treatment. It is available. Unfortunately, there isn't education on the menopause. So we know that only 40% of medical schools actually teach the menopause as a mandatory module. So again, this is why there's been a lot of either misdiagnosis or lack of support really, is that it's not mandatory within medicine. So that's one of the things that we're really trying to drive through the different companies, is how do we make sure that healthcare professionals have the information they need? Because surprisingly, there's a Facebook group which is for women in medicine who need menopause support, and they're asking the same questions as everybody else. And I think that's the bit that I've found really sort of quite shocking, to sort of say, how do we support everybody? And so the Balance app has been created for that. And again, we have physical symptoms of the menopause. So everyone tends to talk about the hot flushes and all of the sort of the traditional pictures of the seven dwarfs. Is it bitchy, itchy, all of those? Whereas actually what we're trying to show is that, yes, there are those physical symptoms, but they talk about the aching joints. You know, you talk about the hot flushes, but also the heart palpitations. You know, a number of women end up going into secondary care for heart palpitations where actually it's related to their hormones. So again, there's a lot of physical symptoms that we don't necessarily talk about. Then the psychological symptoms, so the low mood, the anxiety, the feeling flat, the I don't actually want to get up to go to work today, and why is that? Because I don't usually feel like this. And then you look at, you know, when your period is and you go, oh, okay, is it related? So I think, you know, one of the key things that the Balance app has done is allowed you to track symptoms alongside when your periods are due, so that you can start to see what's happening over a period of time and start to go, well, maybe it is hormone related, or is it something else? But at least you're starting to sort of empower yourself with the knowledge, but also what's happening with your own body. And I think if today is about anything, it's empowerment really, and how you can support that. So we look at the influence of estrogen across the body, and you can see there that it's absolutely everywhere. And we were just talking earlier about, we know that women who are on either the combination pill or on HRT are less likely to develop severe symptoms with COVID. And we know that very few, if any, have been admitted to ITU with COVID. And we know that COVID has been disproportionately impacting men rather than women. And so we've knocked on a lot of doors to say, well, what are you doing to investigate what you can do with estrogen? Because it's low cost, it's effective, it's, you know, already a hormone in our own body. So why wouldn't we try it? And it's like, it's been dismissed for quite a long time, but now we're starting to get more interest in this because they are seeing that it does have an impact. So it has immune protective systems for us as well. And then the other element is testosterone, which I haven't got the same, but there's a similar slide that shows you testosterone, which is in our own bodies. Okay, we don't produce as much as men, but it is a female hormone as well. And you'll be surprised to know that in the UK, men are prescribed testosterone as soon as they've had anything happen in hospital, but women, as soon as you've had your ovaries removed or a hysterectomy, aren't giving your hormones back. And so it's very interesting how we're now trying to change that, but also men can be prescribed testosterone. Women are only prescribed a male version of testosterone. We have to limit the amount because it's 10 times what we need. And the female testosterone that is available is currently off license, looking at how we can drive that and change that moving forwards. So what's the problem that we're solving? And you've kind of touched on it with mental health, but it's the same, you know, there's some overlap here around the psychological symptoms, in that we have 47 million women each year reach the menopause. That's 400,000 within the UK. 25% suffer from severe symptoms, but 77% don't realise that those symptoms are due to the menopause because we don't talk about it. And 79% have visited their GP about their symptoms, and 7% of those, it took them 10 appointments to get any adequate support. So if you think about the amount of time they've taken off work, or that they've gone to seek help and haven't got help, and it's the fact that 44% of the women had to wait more than a year, and some of them, it took 5 years to get adequate treatment. And I think this is the bit that we go, how many people have been prescribed antidepressants, whereas actually it's their hormones? And we hear about treatment-resistant depression, and then we hear about women being sectioned. We hear about, unfortunately, women taking their own lives because they haven't had their own hormones. And Louise is on tomorrow morning, talking about suicide awareness and how that changes during the perimenopause and menopause. Because again, There isn't training for psychiatrists to even ask the question about what's happening with your periods. And a lot of the drugs that then they are then given means that it reduces their hormones. And so it's kind of a double whammy. And this is what we really want to do is just sort of raise the awareness. So women over 50 are the fastest growing segment of the workforce in the UK, which is something to be celebrated, I feel. However, when their menopause symptoms start to impact on their lives, this is where we feel that there's a whole equality and diversity and inclusion impact that we're trying to address. And how do we make sure that they're given the right support to rise through the ranks and to thrive at work? And some of that is about acknowledging that some of their symptoms could be perimenopause or menopause related, and how do we make them aware? And this is where we've kind of created the Balance app. And it was originally because of trying to scale this information to treat so many women. The stories that, you know, the team have heard through the clinic are horrific at times, but they're also transformational in that once they have the right treatment, they go back to work, they have their, you know, they bring their families together again, or they get the support that they need. And that's where Balance really is there to empower them with the right information. There's a community where they can share their own stories with other women. The women supporting other women is fascinating on this group because they're just so supportive. And they do it voluntarily. You know, this isn't a group of women that we say, oh, can you just put your story on here? They do it on their own, and there's thousands there that you can go. Because of how many different symptoms there are, it's really useful to have people talk about their own stories because they go, oh, that resonates with me. That's really interesting. I hadn't thought about that. Or, you know, that can I just understand a bit more about your experience and how did you, you know, get treatment, etc. And they can rate their own treatment that they're on, but also they can track their symptoms and download a health report. And it's that health report back to the, I've got 7 minutes to talk to my GP. How am I going to summarise everything that I'm feeling? Well, the health report is really there to allow you to do that so that when you go to see the GP, you don't go in and go, oh, I'd forgot about the brain fog. Yeah, I'd forgot about that. I'd missed that street. Or I'd forgot that I'd put my keys in the fridge that time. So I think it is about making sure that there's a way to capture it. And it's a very different discussion that if you go to your GP and say, I'm having heart palpitations, they'll probably take you down a cardiovascular route, which is appropriate. But equally, if you said, oh, I've got heart palpitations and it's these times of the month and I've got these other symptoms, they might go, oh, actually, let me just hang fire a bit and think about, you know, we know how much pressure GPs are under, and it's about facilitating that conversation to allow that, you know, to work more effectively, really. So for businesses, the Balance app was set up to help women to empower themselves. And then because the news and the message was getting out there that it was helping so many women, businesses were coming forward and saying, what can we do? How can we help our staff? Which is fantastic. And we've been sort of overwhelmed. And these leaflets are in your bags, by the way, so you can take them around. And we have a little challenge going on as to where's the most random place that we can get one of these posters put. So, you know, if it's on a loo door, if it's somewhere random, great, that's what we want to do. But so we created posters, but there's also now a corporate course that we've created and is being released later this month so that it can literally just be disseminated to all your staff. You know, it's really quite easy to then give them the medical knowledge about the menopause, the impact on mental health, but also for line managers and for men, how do I have that conversation? You know, I'm really conscious that some of this is quite personal. They are, you know, symptoms you don't necessarily want to bring up, but if we can start the conversation, then I think it's so important, and in allowing women to be able to go, okay, I can talk about it, but then I know that there's support. So we know that the huge loss of talent within organisations, and it's about how do we start them to have a conversation so that we can keep them and allow them to thrive at work. So in addition to Balance, we've created Balance Plus, which is a wellness companion to support women, because we know that 64% of women who get onto the Balance app are able to access treatment. So currently in the UK, there's only 12% of women who are on HRT. and that's good compared to a lot of other countries. But through the Balance app, those that are on the app, we know that more than 50% have been able to access treatment because they've had the knowledge to empower them. Balance Plus allows you to look at, there's different channels for skin, hair, Pilates, yoga, nutrition. So again, these are people that have worked with the clinic for a long time, and they're at that intersection of menopause and their own specialty because, again, this is about the holistic view. It's not just about treatment with hormone replacement therapy, but it's your lifestyle, it's your nutrition and everything else that you can do to help yourself. But we know that when women go for consultations, lifestyle isn't necessarily covered. And that's the bit that we want to make sure is addressed, is that it is a more holistic view of well-being. So we've also created a policy and a document to help guide organisations, because whilst a fan on the desk is helpful while you're having a hot flush, actually we want to guide people towards obtaining treatment. And having the information that allows them to do that. And that is one of the challenges that we're looking at. How do we allow corporate organisations to provide treatment support, whether it's time off to attend appointments, or what does that look like? Because we say, well, you don't have a broken arm policy, so why do you have a menopause policy? But actually it's about framing it appropriately and making sure that we're raising the correct awareness of that. So, interestingly, you mentioned, Jane, earlier, didn't you, that about it's not a business but a cause, and that's really what Balance is about. And how do we make menopause support inclusive and accessible to all? Because the app is free, so that we can make sure that the information goes out to everybody. We recognise that it's not yet in different languages, and that's one of our ambitions, is how do we get this information global? We've got to get over some of the cultural challenges, but also the lack of information or research that's available for what happens in different ethnicities, different communities, what's the impact. And again, that's more work that we need to do, because we're very conscious that we still don't help every woman, and that's kind of what our ambition is. Louise, when she set up the clinic, was told, Louise, you're not going to be able to help all women. She's like, just watch me. And now there's a group of us working together, and we all feel the same about, no, actually, we can help lots of women, and there's ways of doing that by raising the profile. And we're also working with NHS England on their national menopause programme, but what we found is that takes time. You know, that takes time, structure, organisation, and actually we can't wait that long. We're kind of going off and seeing what we can do ourselves, and this is where I think corporates have a massive opportunity to really help the people that they employ in giving them the right information, whether it's the men or the women. The fact that, you know, men will be turning up tired because their wife's been rolling over and tossing and turning all night and going, oh, I can't sleep, and then they turn up to work tired and not on their game. So it's about providing information for everybody so that they know how they can support their loved ones, whether it's their sister, their mom, you know, their wife, all of that. So this is just really a story from Sally, who said, after suffering with what I thought was depression for many years, it took Louise's articles to show me that it was not depression, but the perimenopause. I went to my GP armed with all the facts and asked her to put me on HRT. This was a month ago, and I have not looked back. I'm 53 and thought my life was beige and boring, and now I'm 53 with a colourful life and so much more energy. I feel like me. And you just go, well, actually, if we help more people like Sally, we have done our job. And I bet she's doing a great power pose right now. So thank you for your time.